So this is the left lung. You can identify the left lung by the presence of cardiac notch and the lingula. Now for the relationship of the mediastinal surface of the left lung. This is the vertebral surface. This will be related to C7 to T10 vertebra and intervertebral disc, sympathetic chain, splanchnic nerves and hemiazygos veins. On the right side the same will be there. Instead of hemiazygos there will be azygos vein. Now for the mediastinal surface of the left lung. This will be related in front of the root of the hilum. In front of the hilum or the root is the cardiac impression. This cardiac impression is related to left ventricle, above that left auricle a small portion, then pulmonary trunk. So in front of the hilum, left ventricle, left auricle and pulmonary trunk. Above the root of the hilum, it is related to arch of aorta. Behind the root, it is related to descending thoracic aorta. So posterior to the root, descending thoracic aorta, superior to the root, arch of aorta, anterior to the root, left ventricle, left atrium or auricle and pulmonary trunk from below upwards. From the arch of aorta, three branches arises. One will be brachiocephalic trunk, another one will be left common carotid, another one will be left subclavian. So the anterior one, if we place the lung in position and if this is the arch of aorta, on the right side the first branch is brachiocephalic trunk, followed by left common carotid, followed by left subclavian artery. Behind this will be the trachea and the esophagus. In the tracheo-esophageal groove will be the recurrent laryngeal nerve branch on the left side given by the vagus. The space which is related to the arch of aorta, in front of arch of aorta, that is between the arch of aorta and the lung, two nerves will be there in the arch of aorta. One will be the left vagus, another one will be the left phrenic. Both will cross each other. The phrenic will come anterior to the root and reaches the cardiac impression where it runs on the pericardium between the lung and the pericardium along with the left pericardiophrenec vessels. The vagus, after crossing the arch of aorta inferiorly, will give recurrent laryngeal branch and then goes behind the root of lung where it breaks up to form pulmonary plexus. Besides these structures, a small portion of esophagus will also be related posterior to the root in the inferior aspect behind the aorta and the root of the lung. The small portion of esophagus, because you know esophagus moves more towards the left side before its termination or before it pierces the diaphragm at T10 level. So this portion is also related to esophagus. So left ventricle, left atrium, pulmonary trunk, arch of aorta with vagus and phrenic nerve, from arch of aorta, brachiocephalic trunk, left common carotid, left subclavian. Behind that is the trachea in esophagus, and tracheo-esophageal groove is left recurrent laryngeal nerve. Posterior to root is descending thoracic aorta. Inferiorly close to it, it is related to the esophagus. The cage with the heart in situ with the left lung. So I am going to remove the left lung and show you the mediastinal relationship of the left lung. So I have removed the left lung. Now you can see arch of aorta giving rise to subclavian artery. This is subclavian, left subclavian artery, left common carotid. This is brachiocephalic trunk, left common carotid, left subclavian. Crossing the arch of aorta, coming anterior will be phrenic nerve, and this is vagus. Both of them will cross. Phrenic nerve will go anterior to the pericardium, vagus will come posterior to the root of lung. You can see after the arch, the vagus is giving left recurrent laryngeal nerve. This is vagus nerve going towards the posterior side of the lung root, and this is the recurrent laryngeal branch of the vagus. So this is superior intercostal vein. So the superior intercostal vein, vagus and phrenic nerve will be over the arch of aorta related to the lung. This is heart with pericardium. This chamber is left ventricle, a small portion of left auricle, pulmonary trunk, and arch of aorta and descending thoracic aorta. In that order will be related. First is left ventricle, followed by left auricle. This is pulmonary trunk arising from right ventricle. Above that will be arch of aorta continuing as descending thoracic aorta. Okay. So this is the medial surface of the relationship of the left lung in front of the root of the hilum. Behind the root of the hilum, it will be related to descending thoracic aorta, sympathetic chain, hemiazygos, superior and inferior hemiazygos vein, and splanchnic nerves arising from the sympathetic chain. So this is sympathetic chain, this is superior hemiazygos, inferior hemiazygos, this is descending thoracic aorta. Splanchnic nerves will be given by the sympathetic chain.